Wikidonist.com. Truth about tooth.
It is great to age, because if you are gracefully aging, you look very good. But sometimes we are always having some old baggage which we take it around. So from 40 years, 50 years, 60 years, sometimes we may be worrying, why didn't we do orthodontics at an earlier stage when you were smaller? You wanted to look good. At that time, you didn't have the money, you didn't have the resources, you didn't have the right dentist in your place where they would have done some orthodontics and got your smiles corrected. Can we do it now? Or you have done some orthodontics, but you were too young and you didn't actually wear the retainers, and now the teeth has come back. Now you want to take it back, and now you don't want to go for a crown or a veneer and do a Hollywood smile, and then you are now looking forward for an orthodontist to do it. And you went to an orthodontist and he is saying, no, not at this time, because you are too old for it. So why do they say that? Because most of the time the insurance company doesn't do it, because until 15 years, most of the governments, especially abroad, support for orthodontics is higher, because they consider it as a functional issue. After 15 years, they tell it is an aesthetic issue, so please make sure that you pay for it. So most of the orthodontists are very happy with whatever the insurance company gives, but private patients cannot pay that much. So most of the time what they do is they tell that, okay, adult orthodontics is not possible for me, because they have enough children as orthodontic patients. That is why most of the time. Then second reason is actually it is difficult much more. They might have some issues like caries, you might have some periodontal issues. We'll have to tackle all these things, so we might need a team to actually work things around, because we might need to do some oral prophylaxis along with or every time you come in. Sometimes you might have to do some dental caries treatment. So most of the people are actually specialists, so they don't want to do any other work. So what happens is they don't want to take the risk of getting your teeth into problems. So that is why they are saying that, no, I don't want to do any adult orthodontics. But is it possible? Will it move the teeth? Yes, it will move teeth even when you are at 60 or 70 or 80, because that is why when you go for an implant correction, then the orthodontist will tell you, okay, I'll move the tooth which is on the side so that you can place an implant. So that means that they are still moving the teeth. So it is not because they don't move, there are complications that can come up. So we have to tackle those things. Sometimes there are some other underlying causes for it. We'll have to tackle that. All those things are actually hindering orthodontists from not doing adult orthodontics. So is it possible? Yes, it is possible, but we might have to do a joint effort, or sometimes we might have to take the help of the periodontist, or sometimes we have to take the restorative dentist help and things like that, and then still do orthodontics. Now, what are the options? See, another reason why most of the people don't like to do orthodontics is having metal braces. See, metal braces is visible, and you are going to a business meeting and then you are putting metal braces. They will think that, oh, at this age, why is he wearing that, or why is she wearing it? So if that is the case, then we can go for a ceramic braces. So that is much more conspicuous. Actually, if you go for a lingual braces, it is much more aesthetic, because it is on the lingual side of the teeth or on the palatal side of the teeth, so nobody sees it. And even better is now actually the lingual braces have a small problem, because the talking becomes a problem, because your tongue is always in contact with your braces. So that is a little bit of problem. So there will be some lisping and things like that. Now there is even better option that is called as aligners, which is almost like invisible, and you can actually remove it whenever you are going for a meeting. So that is actually a very good option if you are going for a your orthodontics at your elderly age. So there is no reason why you should not do orthodontics at your elderly age. It can still move. If you have lost some teeth, if you have lost 1 or 2 teeth here and there, we can still use an implant and then still correct your dental treatments at this age. So there is no reason, absolutely no reason, or there is no absolute contraindication for orthodontics even at 80 years of age. Unless you have some major issues like cancers and radiation which has been done or something like that, still we can do some smile corrections and we can still correct your teeth, but may not be with orthodontics. Otherwise, all the cases can be treated with orthodontics and get their teeth corrected and having a great smile is not at all a impossible thing. It is possible. It is not very simple, but it is quite simple for you. It is actually a little more complicated for the orthodontist. So but get a good orthodontist and get it done, and we'll be able to make you look and laugh, smile, and have a great time with your kids and grandkids if you are a little more elderly. But it is possible to move teeth. It is possible to move and make your teeth, or even crowding or even cross bites and things like that can be corrected with orthodontics even at the age of 80 years. So don't worry about your age. Age is just another experience. So we all become aged at one point or the other. There is nothing called as aging which can hinder any of the treatments. We are actually advanced in treating even the elderly with the finest of the treatments. So have a great smile. Please subscribe, please like and share, and please follow me on Facebook and Instagram, so that you will understand more about orthodontics and even other branches of dentistry like periodontics and endodontics, and how to keep your teeth well, and even some tips about how to help others in doing all these dental issues and things like that. If you are having a specific problem, please write to me, comment on this video so that I can contact you directly. If you can give me your number, I can definitely contact you. Thank you very much. Dr. Thomas Nechupadam from Dr. Nechupadam Dental at Marine Drive. Please make sure that you watch Wikidontist to know more about dentistry. Thank you very much.
Wikidontist.com. Truth about tooth.